So what about those people that have been told, like they're 20 years indentures, and they were told elsewhere, can't get dental implants because you don't have enough bone? Yeah. You say that's not the case anymore.
Yeah, and it's a common thing that I hear. I get lots of patients that have been elsewhere that say, you know, they were told they don't have enough bone. There's so many things that we have available to us today. How we can build bone. There's ways that we can do blood concentrates that send signaling cells that say, hey, I need more bone. And there's all these procedural things that we can do that we can build bone. Or we can place implants in different areas to make sure that we have sufficient foundation for whatever teeth that we put in there. But not enough bone is not something that I have to tell a patient once a year. It's just not a common thing.
So and even if they're 80s or 90s, you say you had a 91-year-old that did it?
Yeah, right. And so there are some medications. You mentioned medications. I mean, if they're on bisphosphonates or these things that affect bone metabolism, these risk factors cause us to come up with a treatment plan that supports what they are. There are tests that we run to make sure that they're safe before we may have to change some things before the surgery.
Okay.
But I'm not saying they can't do it. We just have to get everything prepared so that they can do the surgery.
Because I guess if you're over 80, most of these people are on 6 or 7 medications.
Right.
So you deal with this every day.
You do, and you have to know the medications, you have to know how they affect things, but then you can either modify with a physician, obviously, or you're going to change the situation in a way where now we can do dental implants.
But that shouldn't keep anybody from doing this.
Right, and most of the time it's not even the case. We manage around the medications. Used to, for blood thinners, you know, we'll get them off blood thinners for 5 to 7 days before. It's rare that I change that.
Oh, really?
Yeah, because they're at a higher risk for stroke at that point. If we're having clots, I don't want that, so we minimize all that. If you're on a blood thinner, it is rare that we're going to change that.
Okay, good for you. So. And these are the same people with very little bone, could walk in with no teeth and walk out with brand new set of teeth, upper and lower.
Upper and lower, same day.
All the time.
All the time, every day.